Good morning, everyone. It's a pleasure to be here and to be kicking off the Teaching and Excellence Conference at BU. It's something that we look forward to every year. It's an exciting day, and we're happy to be uh, presenting first. We're going to talk about our experience this fall with using movies of e-portfolios for assessment. But before we go further, I want to just put in a quick disclaimer, and that is that we're going to present to you our experience in making movies about e-portfolios and in using these movies for assessment. But this is our first attempt at doing it, and we have a lot more questions than answers. So we're hoping that during the course of our presentation and the questions afterwards, you will help us clarify some of the issues that come up in our presentation and move us forward to improve this tool assessment, this type of assessment tool. So let's tell you a little bit about what we're going to do today. First, we're going to tell you a little bit about our course. We're going to talk in general about e-portfolios and using them for assessment. Tell you about our mid-semester video project, some of the results that came out of that assessment. And we're going to actually ask you to assess the students' e-portfolios. Then we'll conclude with some thoughts about this whole process and some final remarks. So our course is called Program Implementation for Global Health, Making Programs Work. And in that course, we partner with NGOs, non-governmental organizations. And this past fall, we had an organization, Farm Access in Namibia, Z-Card in Zambia. We worked with the Boston Lesotho Health Alliance that's based out of Boston Medical Center, but whose offices are in Lesotho. And we worked with an Indian NGO called ASHA that provides services to 400,000 slum dwellers in Delhi. The course is team-based. It's very intensive and fast-paced. We work prior to the course with the NGOs to develop 5 scopes of work for 5 different implementation problems. We have scopes of work for human resource management, for quality improvement, for information management, pharmaceutical management, and financial management. And each 2 weeks we deal with one particular scope of work. Students have to communicate with their client organization and have to respond to the scope of work with an analysis and recommendations for the organization. We use e-portfolios extensively in this course. We use them for documenting individual reflections on leadership throughout the course and the team process. We use them for documentation of individual skills and competencies. We also use them to present the work of the teams, the deliverables that the teams are providing to the organizations. This is useful for the organizations because they can see what the students are doing and provide feedback, but it's also useful to the students on the other teams because they can also look at what the other teams are doing in the course. And this year, we expanded our use of e-portfolios and tried to incorporate them into our assessment process. Helen Barrett, in her very excellent white paper on researching electronic portfolios and learner engagement, describes a tension between two conflicting paradigms of e-portfolios. There is the positivist model and the constructionist model. Now, the positivist model is often sometimes called the assessment portfolio because its purpose is really to assess learning outcomes as defined externally. And with this positivist model or assessment portfolio, selection of the items in the e-portfolio is structured for the students by the professors. This is a model that doesn't resonate well with me. I'm much more comfortable with the constructionist model, which sometimes is referred to as the process portfolio. And in the constructionist model, learners construct their own meaning, and that meaning, of course, will vary across individuals over time and with purpose. The selection of the items in the constructionist model reflects learning from the student's perspective. Now, when you use an e-portfolio for assessment, you have to add a few other concepts. Helen Barrett says evidence of work, which I think we could use for assessment, requires three things. It requires an artifact, that's the material that is put in the e-portfolio. And in our case, in our assessment, we actually let the students choose what went into the movie about their e-portfolios. The reflection that the students provide about that artifact, and finally, some kind of external validation. And in our case, we used the ourselves as professors reviewing them and validating them, but also we involved human resource professionals in international health organizations around Boston to work with the students as well and to validate their e-portfolios from their own perspective. So we'll talk a little bit about that shortly. So the objectives of our video assessment were to highlight program implementation skills and competencies, place those competencies in the context of one's current and future public health career, and finally, we had a third objective that was really to expose human resource professionals who are working in international healthcare organizations and who are potential employers for our students. We wanted to expose those HR professionals to ePortfolio and to our students, our excellent students who are in the BUSPH MPH program. So we had some very simple instructions for the students in preparing their video. We asked each student to create a 5 to 7 minute video with QuickTime or with Windows Movie Maker. We did not need to provide any technical assistance in producing the video. That was a question we had going in. We felt that we wouldn't have to, and in fact we didn't have to. Students were very resourceful in creating these videos. And when the videos were made, we asked the students to post them on YouTube and send us the link. So once the videos were done, we arranged for 7 different HR professionals in different international health organizations to send a letter to a group of students and to invite them to send them their e-portfolio and then to schedule an appointment to meet with them to discuss the e-portfolio movie. And We briefed them before this process on the telephone, explaining the nature of the exercise and what we were looking for, and we gave them a rubric. We also, of course, assessed the movies ourselves. The grading rubric, um, this is what we had on the rubric. We asked the HR professionals to use a 3-variable Likert scale, exceptional, adequate, and needs improvement, and we looked at these different criteria: presentation style, clarity and organization, project's competence and technical acumen in regard to program management, and then whether or not the student projected confidence and technical acumen in our the four uh, implementation areas that we covered uh, in the course at that time, and then their overall subjective impression of the movie about the e-portfolio. And you have actually on your table a condensed version of that grading rubric, and we're going to ask you to use it in the next couple of minutes. Because what we're interested in doing is showing you some brief examples of the movies made by our students and having you assess them using the little rubric that we've provided on the tables. And what we're really interested in, and maybe we can have a discussion about this when we're done, is what do these video assessments demonstrate student competency in program implementation acquired during the course? We think maybe they do, but we're very interested in seeing what you think. So let's look at the first video. So, we're very interested in your assessment of these e-portfolios. So if you want to um, just leave them or pass them and we'll come around at the end of our session and just pick them up from you. And uh, we're interested to see um, whether these e-portfolios met the criteria on the rubric. So in conclusion, what can we make of this first experience and where will we go with it? First, we were blown away by the variation in approach, and I think the three videos that we picked were quite different and um, demonstrated a little bit that very wide variation. Um, there was variation in the way students created their narrative, variation in the artifacts that they selected to present. There was variation in the reflection, the type of reflection or lack of reflection that they demonstrated in discussing the artifacts. And a lot of variation in the way they connected the course to career and the way they presented themselves to the HR professional. Um, the assessment really required students to independently select and integrate and present their knowledge and skills. And that to us seems very well suited to a practice-based course. It aligns goals and interests. We also think that there were multiple opportunities for HR professionals to learn about what our MPH students are doing, learn about PUSH, and I think they did provide some very valuable coaching to students. They were engaged in these videos. They felt like they got to know the students, and they were very interested in talking with them to help them build their personal narrative. So in conclusion, we really started this project because we were interested in how students were incorporating learning from this course into their own personal skill set. We think the assessment is well aligned with goals and activities in the course. And we think we can do a lot better in the future by being more specific about the project. Now that we've done it once, we know a little bit more about how to present it to the students. I think it will be important going forward to let the students know something about the HR professional that's going to review their e-portfolio so they can tailor it somewhat to their interests and experience. We think that the video assessment provides insight into what learning students think is important and to the extent to which they've been able to incorporate the knowledge and skills acquired in the course into their vision for themselves as public health professionals. And we think that the validating the assessment, both through an HR professional review and evaluating it ourselves, is useful to the students and provides some feedback which they can use to strengthen their performance in the course going forward, but also to become more effective public health practitioners. So thank you very much. We're going to come around and collect those rubrics, and we appreciate your helping us out with this. Thank you, and we'll take some